timetable of this conference. I'm supposed to give a lecture or some lecture on distilling research evidence for policymaking in the environmental ecosystem, as part of the conference that is going, which has been organized by our dear and innovative researcher, whom I always say, yeah, she's making a lot of strides in the environmental ecosystem. So I'm trying to give you something today, but probably it's not going to be the one that you expect, but I think that is the one that I'm going to give you, and later on you will discuss. So what am I going to say? First of all, what is evidence synthesis or systematic review? What evidence synthesis, why evidence synthesis or systematic review? Or what are the types of evidence synthesis you know? Why am I asking this question? Because in this policy ecosystem, you would need evidence, solid evidence to make your policies. But in Africa, as we all know, normally people say that nothing in Africa works. But from now, we are going to make sure that everything in Africa works. Some people even label us as what? Shitholes. And you all know in the media, you know who said it. Oh, this shithole. People have labeled us wrongly because they think that Africa cannot do anything on its own. It is up to you and I to begin to change the dynamics of the ecosystem and to now create the Africa we want. So it's a big responsibility. So I'm happy when Jamie called me to be part of this. I'm so happy, and we're going to work together to see what we can deliver together to contribute into the building of Africa we want. So my area, I'm going to talk mostly in the health area for now, and I'll tell you why I'm doing that. And for some of you too, because you are glued to your ecosystem issues, so that sometimes you don't go beyond that, beyond your own spectrum. Now I'm going to move you across, and then now later on you come back to your environmental. So I'm going to say the sophisticated society. Now our modern society increasingly is becoming ever more sophisticated, and for that matter, healthcare delivery. So over here, put over the environmental. That's what that we are going to do, and you see why I'm doing that. So environmental issues are becoming also complex in whatever. Our patients, now you put over here, so over here, what it means over there, you put it over there, are also becoming increasingly complex. So would be our policy making. Let me give you a story about what happened in Ghana in the healthcare industry, which I'm using to illustrate my point for today's delivery. Suwaiba missing baby controversy. And then if you can, we read over here, Suwaiba, a mother from one of the disadvantaged suburbs of Kumasi. Kumasi, the second capital of Ghana. Under very mysterious circumstances, lost her baby, said to be stillborn. So this mother went to the hospital. And then when she was going, she was all right. She was going to deliver. This was going to be a CS, I think serious delivery. So this woman had been prepared, and it's going to be elective. Elective means that you are not going to be put, you are not going to spend a lot of time, or you were not sick when you went there. But when after delivery, they said, your baby was stillborn. It means that you had a stillbirth, that the baby didn't survive. And she said, okay, according to my customs, my tradition, please, I want to see the face of my baby before burial. And the hospital staff could not retrieve the baby, the body of the baby. This became a headline in Ghana, and this was reported in this ministry. So this Suwaiba's case exposed lapses in the healthcare delivery. And I'm thinking that now, some of you in the environmental, there have been some incidents that have also exposed some of the lapses in the environmental and policy ecosystem. This woman that you see over here was then the health minister, sitting in the ministries in Accra, far away from even the regional capital, where that Konfanochi Teaching Hospital is a teaching hospital, well-known teaching hospital, where the incident occurred. She was invited to come and answer questions. Why would that happen? She was not part of it. She don't have any knowledge about what was going on over there. But here's the case, this woman had to come and answer questions. The whole thing I want to drive at is that now you are in policymakers, you are making policies. Yes, there will be a time that something goes wrong under the grassroots. You don't even know what is going on over there, but you will be called to come and answer questions. Because what? Now you are accountable to them. So how can you then address some of these issues not happening so that you are not confronted to come and answer questions? These are some of the things that I'm going to do. So I'm using the health ministry, which I'm too familiar with, as an example. And the reason why I'm doing that is also, I'll tell you when I get there. Let's move on. Our society is becoming increasingly complex because initially the health system thought that this woman came from one of the disadvantaged suburbs. They are not well educated. So let's tell them anything. They will accept anything. But this woman, the Suweba woman that we are talking about, proved them wrong. That we are no longer living in the olden days. Now we are in the information era, that WhatsApp and everything is there. So if you I would just trickle off and just using your using your mobile phone, you can send anything to the information or the news media, and they will make a hay around it. So that is what happened. So these people were confronted, but it was a surprise to them because they never thought that anybody from such a place would make that case against them. This led to most of them losing their job because some of them had to be sanctioned. Why would somebody come to the hospital? But in the behind, other people also had the notion that there was a syndicate going on over there, that some of them would come, and then when they give birth, depending on where you come from, the other people had made it a business that they will sell your baby to someone else, and they tell you that your baby is stillborn. And because you don't have the power to challenge, they just tell stillborn, we have thrown the baby away, or we have buried the baby or something. That's all. But this woman showed them that I'm coming from a disadvantaged background, but I'm going to expose you. Whether it was true a syndicate over there or not, nobody knows, but it exposed some lapses over there, and also some of the issues that people were talking about, those who had had previous experience. Just because what? Our patients are enlightened, and your policy environment, the people you'll be dealing with the landowners and those, and depending on those who the actors, they are now enlightened. You can't just give them any information and think that, yes, we are dictating the terms of the reference of the, okay, whatever we are doing. No, of the policy. It's no longer the case. Let's go to another person. This one I'm using also. I'm using this one as improved information system and social media. When I saw the beauty of the brochure that it was displayed, I would say, oh yes, this innovation has gone into it. And I was happy and congratulated Temi for that. Because you can see that the beauty of it and innovation that went into it. Just because nowadays, all this information system and everything, the things we need to improve how we channel our information are there. It is up to us to use it. This happened, a woman self-diagnosis ovarian cancer over the internet. This was a 23-year-old lady who visited her general practitioner so many times with a complaint. I'm suffering, doctor, help me. The doctor would give some medication and go, and next time come back. This lady repeatedly, there was no diagnosis, but the kind of what she was feeling was so, it was, I don't know how to express it. Those people who have gone through some of these serious conditions will know. So she took it to herself that no, I won't sit down. Now social media is there. We have information system. Why don't I sit? He started searching with the terms that she was using based on the condition that the presentation, the symptoms that she was experiencing. And she was able to diagnose that she was having ovarian cancer at a terminal stage. And now she went to the doctor and told her what she found. And when they did confirmatory diagnosis, they really confirmed that it was cancer at a terminal stage. Had this lady had the complaint been diagnosed early enough, she wouldn't have reached the terminal stage. When you get to the terminal stage for this, when we talk in the medical terms, it means that there's no cure, nothing. You can't do anything. And sometimes your days are numbered. And depending on the stage, maybe a few days or few weeks, you will pass away. And so, if the GP had found it earlier on, probably something could have been done. But I'm telling you that nowadays, like the patients in the health system or in the health ecosystem, they are enlightened. They have the social media at their back. If things go wrong, they are going to prove to you that they also know it. And the same thing, I'm relating this to where you are, the ecosystem. If something goes wrong over there, the people who matter, they will take the case up, and very soon it becomes news. So nowadays, it means that the patient can post their health problems in social media and get overwhelming response and even interventions. So where you are in your ecosystem, the information is there. If you put something, if you just put something, the search terms on the internet, you get overwhelming response. And if something goes wrong, that is the same. We have the Twitter, we have the Facebook, and you have everything. So policymakers, those, and also in the research science ecosystem, we have to be very careful now, because there's no longer we can hide information or how we do things. Everything should be transparent, because people are watching, and if something goes wrong, there will be stories written around it, and you'll be called to answer questions. This man saw what was going on, the changing ecosystem, and how society is becoming complex, and now the population is becoming complex, and he wrote something. This one is the health ecosystem, and said that the future of healthcare delivery. So relate this one to where you are, the future of environmental issues, why it must change, and how it will affect you. So now begin to look at some of the topical issues in your own area, how some of them must change, and how, if they don't change, will affect you. So you are the expert over there. This is a question that I'm throwing to you. No doubt. So now, the contemporary society or our ecosystem is that pressure is growing for reliable evidence to inform every decision that we make, healthcare decisions, policies, and whatever decisions that we want to make. Because what? Those involved, the players, the actors, are all looking for information or the best evidence to inform their choices. In this healthcare ecosystem, the practitioners, the patients, and policymakers are all looking for the best evidence on benefits and harms of health interventions and comparative costs. This is because they know that health interventions do not only lead to beneficial effect, but sometimes it can also produce harmful effect. And so where you are, things don't go the way you want every time. Sometimes things can go in a different direction, and other people who are part of the system are looking for information, the best information to steer the affairs of what the ecosystem warrants. So researchers are seeking, that's why I'm bringing not only policymakers, because I know this conference also has some researchers attending. So the researchers are also seeking the best evidence to inform their design and conduct of the new study. So over here, let's put it into two categories. Policymakers want the best evidence to inform their policies. And then even the researchers that are supposed to produce the evidence are also looking for the best evidence to inform their own research. This led to the evidence movement. So what is the evidence movement? In the medical ecosystem, that's what I'm using. It led to what we call the evidence-based medicine. And what does evidence-based medicine mean? It means that the practitioner is here. For example, put yourself as the policymaker. The patient over here, the person who needs the information from you or who needs your assistance. And now this is the best external evidence. We are saying that you can make policy, evidence-informed policy when you have combined the factors in your, all the factors in your ecosystem together with the best external evidence. And then let me ask you, in Africa, where do we get the best external evidence? And you, even in the environmental area, where do you get the best external evidence? You are the policymaker, you want to make the policy anyway. Yes, you can do it. But we are saying that now you need the best evidence to inform you to make sound decisions. How do you get the best evidence? And that is why now researchers become important in the story or in the scene. That is, this is a made up of actors that we have policymakers, we have patients and other beneficiaries. Then researchers become important in the ecosystem. So let us, this person wrote something about evidence-based medicine. The reason why I'm using this in the medical area is that what you're going to be doing in the next few days or weeks, trying to generate the best form of evidence. Everything that you're going to do is centered or evolved from this medical area. And then some of the databases that that I'm going to show you later on, not today, because you have agreed. Temi and I, she would now arrange a workshop for those who have attended the meeting today. That workshop that will take participants through how to distill this research evidence you need for policy making. We're going to work on it. It's going to take us about 1 week. But we are going to say that everything started from this domain. Read the history, and I'll give you instances that you can read, and then readings that you can. And you see that everything points to this evidence-based medicine. That is where it all started. That's what I want to use. For you to be able to evolve, you have to know what exists. And so I'm not going to talk about environmental now. I'm going to talk mostly on medical area. And afterwards, we would move into environment and see how we can generate the evidence that we need to make environmental policies. This person wrote this paper and it has been cited how many times? 17,431 times. And it's about evidence-based medicine. And this started not long ago. Evidence-based medicine started in the early 1990s. So you know that when you talk about evidence-based environmental policies, this would just, maybe it's just not evolving. And if you visit some of the materials that I sent across some time back, it started just recently, after the millennium, and even not just after the millennium, about 2010 coming, not long ago. And all of them adapted the evidence-based medicine principles to the environment. So this is what I'm trying to tell you something about health. This is an opportunity to also to tell about something different because you are used to the environment. Now let me tell you something small about health, where everything started. And then if we understand that, then when we are doing the policy, we know where things started and where we go in, so that anytime we use that one as the bottom line or the baseline. So in producing the best evidence, we're going to use one method called systematic review or evidence synthesis. This, regardless of where you are, it can be in the media, it can be in botany, it can be in climate change, it can be health, it can be pharmacy, everything. We're all everywhere now. Scientists are using this method, systematic review, to produce the best evidence. So I'm going to highlight on a systematic review, what systematic review is. So the reason is that generating the best evidence for policymaking, you're going to use systematic review. And the systematic review is systematic, whether it's environmental. So it depends on the actors that will give it the name, whether it's a systematic review or health problem or environmental issues. But in all, they will all follow the same principle, the same steps. That is what makes systematic review unique. So even I'm starting over here today, I can take any issues in the environment and write a good systematic review about, because following the same method. It is a secondary, it's a form of secondary research. When you talk about secondary research, a lot of people misconstrue this one to be secondary analysis, but we are not talking about secondary analysis. Secondary analysis is different from secondary research. That attempts to collate all empirical evidence. So where you are, if you want to now generate the best form of evidence to inform the policies in the environmental area, you have to attempt to collate all empirical evidence. That is, all studies that have been conducted and completed. But this study, when you want to do a systematic review, you have to come with pre-specified eligibility criteria that you will use throughout, and that you use to answer a specific question. So systematic reviews answer specific questions. How do they do it? By distilling evidence at the highest level of evidence possible. So this produces the best form of evidence. It uses one explicit, take note of that, explicit, transparent and reproducible method. So it's methodical method to what? Identify studies, and this is what you are going to, if you want to produce the best evidence, this is what. Forget about what I said in connection with the health. If you're doing environmental evidence synthesis, this is the process you're going to take. You use explicit, transparent, reproducible methods to identify the studies, select studies, critically appraise or assess quality of the studies that you include in your systematic review, extract and analyze data, and report the results in a clear and accessible format. And after that, you have to interpret. So it follows the normal way of writing a manuscript and publishing a study, except that this one is secondary. The unit of analysis is a study. You are combining that, you are looking for studies that have been already completed to form the basis of your evidence. You are not doing a primary study. Primary study is when you have collected primary data and analyzed to produce one's manuscript. But this one, we are going to combine a lot of studies to answer the question that is at stake. It involves meticulous effort to minimize bias, thus providing more reliable findings and conclusions. A systematic review may or may not include a meta-analysis. Now over here, let me pause a bit. When you are doing a systematic review or distilling the evidence that you need for your policy, the systematic review may or may not include a meta-analysis. So we're going to talk about what a meta-analysis is. You may do a qualitative systematic review or evidence synthesis, but mostly systematic reviews involve meta-analysis and what we consider meta-analysis. Let me talk about this before I go into meta-analysis. High quality systematic review. It means that we are saying that you need systematic review evidence to inform your policy. So we may fall on systematic review, but where do we get the high quality systematic review? High quality systematic reviews are the ones that are able to identify all relevant published and unpublished evidence to include. That would select studies or report for inclusion and assess the quality of each of the study or report included in the systematic review. and after that, synthesize the findings from individual studies or report in an unbiased way. This is very important. And it does that also even when you have produced the result. You have to interpret the findings and present a balanced and impartial summary of the findings with due consideration of any flaws in the evidence. So critical, when you're interpreting, you consider a balanced way of interpreting the evidence and then taking into consideration flaws in the studies that you have included in your systematic review. So this is systematic review. I'm jumping because we will deal with systematic review later. Why is systematic review important? Let's look at this scenario in the healthcare industry, and the same thing applies to the environmental ecosystem. Over 3 million papers are published in over 40,000 biomedical journals each year, as at 2017, before the era of the predatory journals. And you know this one, the advent of the predatory journals has now increased publications exponentially. So if this one was in 2007, currently I think about 80,000 publications are made in the biomedical journals. Over about 5 million papers are published in over 80 biomedical journals each year, around as at probably 2019 and 2020. Most of the studies also are unable to, we don't publish them. And why is this so? And we can scan back and see most of the studies that our students do, most of the theses, the PhDs, and then the masters in Africa, most of them don't get published. As soon as they defend their thesis, they are done. So if you include all of them, and we are saying that systematic reviews include published and unpublished studies. So add the number of unpublished studies together, it means that we're producing about over 6 million papers a year in only the biomedical area, not in environmental. You know, the environmental area, a lot of studies are also being produced. So many more studies never get published. To maintain current knowledge, one has to read about 40 articles a day. Now I'm saying that things have doubled. So now it will mean that reading about 70 to 80 papers a day. Let me ask participants, how many of you read 2 articles a day to keep yourself up to date? Regardless whether you are in the health ecosystem or the environmental ecosystem, how many papers do you read a day to keep yourself up to date? I don't think most of you are reading 2 articles, unless maybe you're doing, you're making a publication on that level, you are doing a literature review, then you read a lot of literature to support your claim. But other than that, to maintain this, to read 40 articles a day or 70 articles a day to keep yourself up to date is something which is impossible. So policymakers, I'm telling you, you are busy, and then sometimes even when the full paper is written, you don't have the time to read, let alone reading the full papers. You only read the abstract. So it is impossible. That is more so when the papers you are reading reach different conclusions on the same topic that you want to investigate, or on the same topic that you want to make a policy on. All the papers, the 40, someone is saying this, another person is saying something, another is saying another thing. And you, by the time you finish reading the papers, you are really confused because each of them is saying different things. So now systematic review become essential. That's why evidence synthesis become essential, because evidence synthesis is supposed to bring all the studies that are reaching different conclusions together to now create one form of evidence. Now to come out with one statement that summarizes all the studies, what the studies are telling, into a common statement that policymakers you need for or to inform your policies. Otherwise, because falling on individual studies, you may make a mistake, because individual studies normally may mislead, because if you took the one that said there was no difference or there was no effect on what you are doing, that is what you take. You said that a study has been published recently in a reputed journal. It says that there is no effect between this and that, or there's no effect on that, then that is what you use to make your policy. And if this study was not done right, then it misleads the whole policy. That is why we are saying that in that modern era, don't rely on a single study to inform your policy, but now, as much as possible, rely on evidence that has been systematically synthesized using systematic review principles and approaches, or evidence synthesis. Then I will ask, how many of you are systematic reviewers? How many of you know how to do systematic review? And how many of you have been involved in systematic review? There's a scenario that I will show at the end of it to show you the expertise we have in evidence synthesis or systematic reviews in Africa. So this slide, I'm showing you to know that although what we are talking about, systematic reviewing and the evidence synthesis, started in the medical area, it has now moved to almost everywhere, every discipline and everywhere systematic review is being done. So in the area of agriculture, education, social welfare, crime and justice, environmental policies, and this is where you form, but this is your ecosystem. So beyond that, there's so many areas that systematic reviews are required, even mass media and communication, international development, income maximization, and then many others. You can list and list and list. And in developed world, no policy is made without systematically synthesizing the evidence or doing a systematic review for. In the clinical guidelines area, where I was part of it in the UK, most of the times every question that we answer has to be answered by a systematic review. So when you are doing a clinical guideline and you have so many questions, maybe 10 or 20 questions in the guideline to answer, all of them have to be answered by a systematic review, no longer on a single study or no longer on experience that, oh, I have read this and that, or based on my experience. No, based on my experience is consigned to the olden days, no longer the case now. So this is where the challenge is coming as professionals who are making environmental policies. Look back and now begin to think about the policies you made or policies that have been made some time back, and think about how many of them have worked and how many of them have sustained themselves and how many of them have achieved what the policies meant to. Most of them did not survive the test of time, and most of them did not even achieve the objectives that were set for which the policies were made. This is so because what? The evidence was not good enough. It was maybe anecdotal. And that is why we are asking that you, the policymakers, you pray, sorry, you are important in the decision-making ecosystem, that what you do have to be considered carefully. Over here, when we start doing systematic review, I've listed what a traditional review and a systematic review are. Many people don't know the difference between systematic review and then the traditional review. They are different. And these are some of the things I've listed over here. So when we start with systematic review, I've talked about that. So colleague participants over there, let me say that because I have been the whole week, as you are doing, I have been involved. I've been the only person teaching about doing a systematic review workshop, and I finished this morning. Ghana, we start before you, so we started early. And then the whole week I've been talking. And this morning, even my participants found that, yes, they saw some tiredness in me. That's not how I feel, very tired, but I don't want to. We haven't met before, so I am also happy, cheerful, and Timmy knows that. But said I'm a bit tired, but we will have to deliver. No, this is not an excuse. But I'm trying to say that when we begin a systematic review, and if you happen to take part of it, we are all going to enjoy together. You consider most of the important things together and see how we produce the best evidence to help policymakers. And even not just producing the best evidence, we have ways of translating the evidence into policy. Because it's not producing the evidence alone will not get into policy. We have ways of doing it. one of them is what I call guidelines. They're coming out with guidelines from the research evidence that has been generated. So let's move on. We're going to talk a lot about systematic reviews later on, not today. Type of reviews. Let me jump also here. Now I'm talking about meta-analysis, because what you are doing, a lot of time you are going to be confronted with meta-analysis. What is meta-analysis? What is meta-analysis? So I'm saying that systematic review will follow this process. Systematic review, there's one slide I showed you that all systematic reviews will have to follow. No. This slide is very important. Every systematic review follows this principle. But whether qualitative, you may have qualitative systematic review, we'll talk about that. Not all systematic review would have meta-analysis. So the ones without meta-analysis, what are they? They are the ones that you would combine without putting together in a statistical way. So you finish the systematic review and report in the tables. I will show you examples of that when we are doing systematic reviews. But this meta-analysis is the statistical component of a systematic review. It uses statistical methods to summarize the result of 2 or more independent studies. So as we follow the methods, you would find out that at a point, the study that you're doing will be a meta-analysis. You have to put the studies in the systematical or quantitative softwares to come with a common estimate. I'll show you an example of that. And it has a value because by combining information from all relevant studies, meta-analysis can provide more precise estimates of effects of interventions done from individual studies included in the review. So that is what that if you combine the studies to come out with one estimate, there's a value to it than when you use only one study's findings to inform your decisions. And the reason is that when you combine the studies, it helps you to be going to find something about power of study. Most of you are scientists, so you know your study is powered. Your studies are powered to detect the difference if indeed it is there. So when we do a meta-analysis, we do meta-analysis when we have one or more studies included in the systematic review. There's one thing that I want to mention over here. We call something garbage in, garbage out. What do you mean by garbage in, garbage out? Although systematic reviews produce the best evidence we need to inform our decisions, not all of them are done well. Not all of them are of quality evidence. So it means the way you do it, and most of them, the way the evidence depends on the type of studies that you have included in your meta-analysis. In the health domain, we call some the clinical randomized controlled trials. I don't know in the environment, in the environmental ecosystem, whether you have randomized trials. And I think you should have, because if you want to study something in the ideal situation, you have the control and you have the experimental group and you observe things to see. I think you have a lot of randomized trials over there. And we're going to show you when we are doing systematic review why we call it randomized and where is the randomized coming from. The randomization is coming from the word random. And how do we achieve that? We are saying over here that the studies you put or you gather in your systematic review would give the evidence that is produced in the studies you include in your systematic review. So if the studies you include in your systematic reviews are good, you get well or good or high quality evidence. So we call it garbage in, garbage out to show that whatever you put in the model gives or comes out. So if you put something good in it, something good comes out of it. When you are doing a meta-analysis, these are some of the things that you want to consider, but I don't want to because we haven't started the meta-analysis yet. But so when you are doing a meta-analysis, these are some of the things that you have to consider. Does somebody want to ask a question? Because I can't see anybody over here. You know that I'm sharing my screen now. So I can't see your mood and I don't see any. So if you have a question and then you raise your hand, probably you can just interrupt me and I will answer. I want to see how things are going, and then how many people do we have? Dr. Tammy, can you tell me about how many people do we have?
We have 42 participants, but there is no hand raised up at the moment. I think some participants are unconsciously unmuting themselves.
Oh, okay.
You can go ahead, sir. Yeah.
Okay. So that is what I think. If you are doing a meta-analysis, these are some of the things that you have to follow. Now, meta-analysis, I'm no longer talking about health. I'm saying meta-analysis because if in the health area or in the environmental area, you follow the same thing. The only difference is that the participant or the entities that you include, the methods are the same. So if you're doing a systematic review in the environment area, this is the same principle that you have to follow. Why is meta-analysis important? Mostly, the difference between the two things that you are trying, it's not that much. The difference, normally, if you are trying something over something, for example, you are interested in the toxicology area, you are interested in about two, maybe chemicals and other things, and you want to see the effect of between the two treatments, the difference. Normally, the difference might not be that much. So your study, the primary study, if it is not powered enough, would miss that effect that you were looking for. So now there are so many studies that have been conducted where because of the sample that you have used, the size of the sample alone, you have missed that effect. We're going to talk something, you're going to talk about them when you're doing environmental, when you're doing this real synthesis of systematic reviews of environmental issues. But meta-analysis, when you are doing a meta-analysis, it powers your study because you have included so many studies assessing the same effect together. And by so doing, you have increased the number of participants or the entities that you are studying to help you to now power your study to detect what you are supposed to study. So when we talk about confidence interval, I think we use confidence interval to also explain certain things in the environmental area. What is confidence interval? And then what is the difference between narrow confidence interval and wide confidence interval? They tell us a lot of things. So many studies have wide confidence intervals say that they have missed the true effect that we are looking for. But when you put these studies together, the systematic review or the meta-analysis narrows the confidence interval for you because it improves the numbers, the denominators, so that your study is powered enough to detect what you're supposed to detect. And let me use this example from the health ecosystem because this is what we are going to produce. You call something forest plot. You are going to find a lot when you start doing systematic review in the environmental areas, that this versus that. But sometimes you don't have comparative studies. If you don't have comparative studies, you don't compare. So we just describe what is there. So for example, if you are comparing two things, I'm not going to stress a lot of the elements here because over here you can put anything over here in the environment ecosystem. What is instead of radiation and something, you can put something over here and use. What it's trying to tell you is that when you produce this something, the confidence interval, the effect estimate, that is what you're going to find in your systematic, the meta-analysis. But I can see that some of you, the faces, and that's why I wanted to look at the faces because I don't know how many of you have done systematic review before. Let me know how many of you have done, please, by just click and show us how many of you have done systematic review before.
Okay. A participant actually chatted that she's currently doing one and she would like to share her experience. But any other person in the house who has done can just raise their hands.
Yes, raise your hands, let us know because you want to fine. Otherwise, so that I know how to go about it. Otherwise,
Dr. Brimo she's about to speak now. Okay, Dr. Brimo, you can go ahead.
Unmute yourself and talk. Yeah.
Okay, I'm into one of these systematic review now with some group of researchers in one of the universities in UK. I was invited about almost 3 months ago.
Yeah.
And they did a lot of compilation of articles, almost maybe 20,000 or more.
Yeah.
And then we started with title review.
Yeah.
So we were given a set of what we are supposed to look out for in the data.
Yeah.
For example, the research must have been done 1990 to date, not below 1990.
Yes. And there might be a reason for the cutoff, isn't it?
Exactly. They give us a set of items to look out for.
Yeah.
It must have been conducted in Africa. It must involve the public space and all that and all that.
Yeah.
So those are the blueprints. Then after the title review, we went to title and abstract review.
Yeah.
And then I was given 1,200 to review within 10 days.
Yes.
So I had to review 1,200 articles, title and abstract, to meet up with the blueprints and then submit before the deadline.
Yeah.
So after now, we are going to full screen, because now we have to check ourselves. 2 people must agree.
Yeah.
If I pick an article, somebody else must agree that that article also is relevant.
Yeah.
So at the end of the day, they are currently compiling whatever their results. Then we will move into the next stage to do the full screening before they now compile the articles that will go in. Proper. We were not told what they want to use with this review.
Yeah. You see, yes, thank you so much. And may I know your name again is
Dr. Brimo, Dr. Olanike Brimo.
Dr. Brimo, yeah.
Yes.
Olanike, isn't it?
Yes, she's from the University of Lagos.
University of Lagos, good.
Microbiology department.
Yes.
Sorry, sir, we still have somebody else. Would you like to take one more comment?
Yes, yes, because this is what I want. If they have this one, if they tell the story, I don't even have to, because that is all I want to tell them about. The need for this evidence and the lack of expertise over here. You see, she had just started, but even systematic review will take time for her to ground herself in the methods to become an expert. So this is just an overview. But to come to this level that I'm talking about needs a sustained way of building capacity. And that is why I'm trying to tell you that now some people were even doing it when I started. But this is what we need to inform the policies that we need to work. In Europe, no decision is made without systematically synthesized. Look at the number of studies. And even they don't care whether you're an expert or not. She has to go through 1,000 something of them, read all of them. And then you have to reach an agreement with somebody. Somebody independently is reading. When we start systematic review, I come there and see how we do it. And you have to reach. Sometimes you say no, exclude. Somebody will say include. So there's lack of agreement over there. So you have to come put that one. I'll show you when we start. I'll show you how we go through all these things. But now, you see, I wanted to use the health sector because that is where all this environmental and the kind of all the other specialties who want to use systematic review started. So they borrowing. So if you know what goes on over here, then when you are adapting it, it's simple. So I'm waiting for the next person also to give us
Dr. Lujimi, you can go ahead. Well, please make it brief because Dr. Danso-Appiah has not finished his presentation.
Yeah, what we're about doing now on systemic review is we are at the stage of registering our topic.
Yeah.
I'm working with a university in the UK where we're trying to do a kind of systemic review on production of some materials.
Yeah.
We focus on Africa because we see that this production is actually common in Africa, and we're looking at the health impact of this production. So we are at the stage of, we formed the group already. Yeah. Then we are at the stage, we've started getting manuscripts. We've not yet distributed, but we are at the stage of registering with a journal. And what the journal, the editors, what we were told was that we will need to register. Once we register this topic, we're only going to have 1 year to complete the review. And we were also told that once we register this topic, they make it, it's like you are getting a patent or something, that nobody will work in that line, and you are only having 1 year to complete that review. If you fail to complete the review within a year, you will lose the right of working on that that topic. So just to what Dr. Burano said.
Yes. So you see, these are some of the experiences, but you can tell immediately that these are all people who are only just beginning to get involved, isn't it? So when I go through the house, when systematic review started and all those, you know that in Africa, and most of them, look at all of them are working with other people from somewhere, and they will only contributing. They are not the ones leading. So where are the Africans who understand our own issues? Where are we? And this one comes to the same story that somebody, the one who discovered Niger, in your country, Niger, when people were already living there. And it is not documented in the books that somebody across the Niger Delta discovered it, but somebody from somewhere came and discovered it. So all that I want to do is sensitization. If we have to. There are some of the things that now Africa has to now begin to see that we have relied on this for far too long. It hasn't helped. And that's what that I'm using about the complexity and how things are changing. And we also have to change. And I'm going to use some historical background how this one started in the health industry and how long and how you are not that late if you want to even to join this group of people to develop evidence synthesis. How can you make a policy without understanding the evidence, knowing the level of evidence, and then appreciating how the evidence has started? So we just go there. And if, I'm not saying, I'm not ridiculing you, policymakers, but sometimes it pains me to know that African policymakers are busy making policies. But on which are you making the policies? The evidence you are making policies don't hold. Then that's not an evidence. So it's on the paper is good. You have made something, but it will not work. And that is why we all along, things in Africa don't seem to work. It is about time that we begin to appreciate some of these methods and learn. So I'm happy about those who have started. Please, the journey is rough, but there's reward in that. If you do it well, the knowledge you acquire is overwhelming, because everything you do adds up to knowledge, whether primary study, policy, or other things. So it's very important. So, and I look forward to.
Yeah,
yes.
Somebody did, because the contributions, the comments we've had so far from researchers, somebody in one of the policy making institutions just made a comment that they're currently reviewing, working with the National Institute for Policy and Strategic Studies to review the presidential report on areas affecting STI. Mrs. Nangwakot, would you like to make a comment also, or maybe a question?
Yeah. STIs are in the health domain, isn't it?
Yeah, so, across board.
Okay.
Go ahead, Nena.
Okay, good afternoon, everybody.
Good afternoon.
In May, the Honorable Minister of Science and Tech had a courtesy call from the fellows of NIPS. And
please tell us what NIPS is. No, everybody doesn't know what NIPS is.
National Institute or Nigerian Institute of Policy and Strategic Studies, SCURU. So they said that they've made several recommendations to the government based on STI on ways to bring on innovation to Nigeria. And it's like their recommendations are overlooked. So they personally came to the ministry to seek a plea with the Honorable Minister, who then at that time had to set up a committee to look into all the reports of NIPS.
Yeah.
I think we have over 45 reports from NIPS. So far, we've gotten 45 reports, and we're going to stream out all STI recommendations there to be able to forward it to the Honorable Minister thereafter. So right now we are trying to get a topic just to harmonize and get one topic for it. It's not easy actually, because I was listening to Dr. Brimo. It's like what we are doing, but hers is bigger than ours. Let me just say it, because she is already in the field of researching. Us, we are policymakers, so some things are like new to us, but it's like building a capacity in otherwise. So I'm enjoying the lecture actually. I like talking to me directly, telling me what to do. So I'm very grateful. Thank you.
Yes, we are happy because we are speaking to you directly, and sometimes it will be you will feel uncomfortable, but that is the gospel truth. We have to confront this one about, and not that it's not anybody's fault, so to speak. It's nobody's fault, but just that we have to sensitize ourselves now. Do you know this is the reason I moved. I lived in the UK for a long time. That's why I worked, if you see my bio. But I decided to move over here to help because my services are not that needed over there. The system is almost saturated with this kind of expertise. But when you come back to Africa, it's nil or sometimes nothing over there. I'll show you some statistics of it and you will see. And that is why now we have to sensitize our policymakers that yes, you are working hard. You are only using what is available there. But go beyond that, there's something new that we can now use so that you advocate for and now help other people to do that, even sponsoring some people, students to take systematic reviews. Most African universities don't even accept systematic review as thesis in most systematic African universities. And the fact is true because they don't know. Those who are supposed to grade or accept, they don't understand the method. They don't know how would they accept it because who is going to even supervise this in the first place. But I see in Nigeria, some of them, the Cochrane branch over there in the medical area, they are doing a lot. They've done a lot over the years, but because most of you are non-medics, that is why. But Nigeria is doing a lot on that line. We'll talk about that. So I'm going back to show you this one again, where the external evidence is very important. You see this Venn diagram. Some researchers, normally policymakers, have made their decision not considering this, the best external evidence. They have just taken or they have used any evidence that they got. But that has to cease if you want to make policies that work. No. Now you have to look for the best external evidence. And I said that the best external evidence is obtained from systematically synthesized evidence. That is why nowadays researchers are very important. Policymakers, you can't do it alone. Anytime you're doing, you have to invite your researchers who have the expertise in methods to help you to understand how they have generated the evidence that you are using. Don't just do it alone. Now let us break the walls between research and policy. And everybody in Africa, the researchers are in their own. Policymakers are doing their own things. And these researchers are just publishing. Many people are publishing and publishing. They don't know what is becoming of what they are publishing. They just publishing, but they don't know what is happening. We have to now follow up and see that if we publish, policymakers have to use. And therefore, we have to also know what policymakers need so that we can help them to produce the evidence they need to help them. Thank you for what you have contributed. May I know how many minutes I have on this one to spend, moderator?
You have about 40 minutes more, sir.
Okay.
But I think within that too, you can also maybe provide some time for feedback or questions and all of that.
Yes, that is important. Yeah, that's important. Yeah, because this one now is confusing because for policymakers, all that they know that they'll be looking at policy document now coming back with these statistics and all those things. But that is the way we go in, and policymakers also have to immerse themselves in this method. They have to understand so that when somebody comes with some evidence, they can challenge the evidence and say that this evidence is not good enough. So I'm challenging you, policymakers. This is the new area or where to go, and we all have to. So now I'm moving away from this. I'm not going to describe it because it's complex. Look at this. All these lines mean something. And this is the source of evidence. I can look at it immediately and see what the whole thing is about and whether it is good or not by looking at the background information. But if you give this one to policymaker, how is he going to use it? The scientists have to come in again to help. So let's move away and you will come to them. And then it's about talking about sample size that we use in our research. I don't know how you do the sampling over there. It's very important. Most of our studies don't really give us what we want because of sample size determination alone. So let's move on. Now let me use this to show you the kind of the pyramid of evidence to show you where systematic review lies. I don't know, can we share what are some of the study methods you use in an environmental domain? When you're doing environmental research, what are some of the methods you use? Let us list some of them. In the medical, these are the research methods that we use, the design that we mostly use. You have the case control studies, the cohort studies, the randomized control trials, and all those. And which research methods you normally use? We are discussed so everybody can talk. We have to understand that so we know what kind of systematic review, the studies that we can retrieve for our systematic review.
Okay, while we're just gearing up to receive responses, one of the policymakers from the Lagos State Ministry of Environment just posted a comment. She said, "Thank you, sir, this is highly informative. However, as a policymaker, we review various reports and technical reports and pass documented evidences on files before recommendations are made. The only area that needs to be included are the research documented evidence, that's the empirical research. According to the lecture, we need to re-strategize and integrate the full systematic review steps."
This is very well written and happy. Yes, I know policymaking is not an easy job. You have to plow through reports and all those. Let me use an example that I found, which was interesting. Once there was a conference and they were distributing some nice book. It's like a lot of art went into it. It was about malaria. And this was a guideline for malaria treatment. And I looked at it, everything. And then now, because of where I'm coming from, I'm interested in the evidence base, the evidence that informed that guideline, because the guideline itself ceases to be a good guideline without a good, without sound evidence or quality evidence. So when I started going through, I came to what the one who wrote this question, I came to that point. They had plowed through so many studies and picked that is pick and choose one. So they plan and then this one choose and let's add this, let's exclude this one. Sometimes they have their own also criteria. It's not that they are doing anything, but whether the studies they included had sound evidence or the evidence was quality, most of them did not have the capacity or have the expertise to tell. Just that, yes, study has been done on malaria doing this, let us include. And then normally, most of them did not, most guidelines in Africa even don't go through the meta-analysis. They summarize the evidence. This study said this and this. So by the time we finish, what majority of the studies are saying is what we're going to follow. And that's one can't be wrong. And that's why I was using this one, but I stopped. All the studies are saying there's no difference between those two treatments that is available, all of them. And these are well-conducted studies. They all got it wrong just because of something small. So if you use one of the studies and you want to make a decision around it, this study said no, there's no difference. Another study said no different. Another study said no different. But look at the final meta-analysis point. Tells us that no, all the studies are getting it wrong because there seems to be difference between when you have done it, this one radiation plus chemotherapy or radiation alone. I'm not going to talk about that. This is something else. So it is at this meta-analysis stage that is when we were able to tell that yes, when you combine radiation with chemotherapy, is better than radiation alone. All the studies, these are randomized controlled trials. The randomized controlled trials are the primary gold standard studies. They all got it wrong. How can they be so? If you are a policymaker and you found tests that is all saying the same thing, wouldn't you say that that is the evidence, that is what the studies are telling us, that's what you will use? So all of the evidence would have been, without what you have used for your policy, will be wrong. Are you getting what I'm saying? Look at all the studies. All of them are saying there's no difference, because if you do, there's no difference. And if you are a policymaker and you don't do meta-analysis and then you just pick the studies, all of them are saying there's no difference. That is what you are going to write and say, oh, of all the studies that we retrieved and went through, all of them said there was no difference. So there's no difference between this and that. And on that basis, you make a policy that there's no difference. Well, indeed, there's difference. And this is what I want to bring about, that most policies in Africa, because we have not adopted this method, we have already got our policies wrong in the first place. That is why they don't work. And this is about time that we need to visit and acquaint ourselves, begin to now embrace these methods to resynthesize and to revisit the policies that we have made. Probably we need to revise most of the policies, but until we use systematic review approach, we will not be able to do that.
Okay. Can I just read comments relating to what you're saying? Because at the moment, at the Federal Ministry of Science and Tech, there is a current review of the National Science, Technology and Innovation Policy. And one of the policymakers in the Planning, Research and Policy Analysis Department was just commenting that I think that the systematic review can be deployed among other methodologies in the National Science, Technology and Innovation Policy that is ongoing. Another researcher from FUNAB, that is the Federal University of Agriculture in Abeokuta, he says that he thinks meta-analysis has been used more by the social sciences than by core sciences. But nowadays, in the face of ethical issues, where obtaining of ethical permissions are becoming more serious, especially on studies that may involve humans or animals, scientists are beginning to push more into meta-analysis.
Well, yes, this is interesting. Yeah, but I don't want to now, because what they've said is self-explanatory. I don't want to disagree or agree until we start the journey of doing systematic review. That is when most people will really see what is in there. But now it's something like sensitization. All that I want to do is that you can't make good policies without understanding the evidence base. And that is why I'm using this pyramid, to tell you that now systematic reviews sit at the top here, the epitome of evidence. It means that's why I was also asking about the study designs that you use, so that we can put them in context and then put the systematic review on top. Whichever study that you use, design that you use, when you pull all the studies, the designs that you use, and you produce meta-analysis, the meta-analysis is better than the single study that you're using. That is all I want to say. So meta-analysis or systematic review has value. And then, yes, I understand that those analyses that other people have done, yes, to inform policies. We are saying, what we are saying is that we don't disagree with that. And we are happy that the ministry, the federal ministry, is making some headways and now appreciating that other areas, systematic reviews have been used, and this will have helped. So now let us look at the areas that systematic reviews having been used and now begin to develop the strategy. And if you like, tell me, I told you when we started talking about some of these things that in the environmental area, this is gray area. It's a gray area for a systematic review. And everything that you will be doing over here is something that we would innovatively have to adapt from what exists already in the health area, because the methods are the same. And that's what we are going to use. So we have to now be innovative and adapt ourselves, because even the documents that we read some time ago, the evidence, the environmental evidence group started not long ago. Few years now, I think 2013 or 2014, just now. So even the global one, not long ago. So if you start now, it will look like an abstract to you. But if you begin, you will be one of the first in the African sub-region to be an expert in this area, because it's an area that is now evolving. It is not there already, even the health area. And I'll show you statistics in the even health area, which started in the early 1990s. We still lack expertise. So let us move on and see how we grade the evidence. This is something that I've told you about. So when I take a paper, I can look at it, and at the end of it all, I'll have something also called critical appraisal. It's another course on its own that I deliver. That one will take maybe 1 week to do the introductory part. That also would help us dissect the research methods that you use to be able to tell that whether the study that you have produced is good or not. And this is very important. And this is also part of our systematic review. When you do systematic review, there's an aspect that tells you that you review the studies that you have included in your systematic review, which you call critical appraisal. You appraise, like dissecting the study to see whether the evidence is valid or not. It's something that, for now, it may look like an abstract, but that is where the world is going. So we better tune into the wavelength and join. It's difficult. Begin to read around it. Let me continue with this historical overview, the history of systematic review. It started in the area of medicine, and a renowned epidemiologist published an influential book in 1972 on effectiveness and efficiency. So there's difference between efficiency and effectiveness, in which he criticized the collective ignorance about the effect of healthcare. So now, even as I'm talking now, if I come and challenge policymakers that all of you are ignorant, you don't know what you're doing because you have used this, people will also be ridiculed, or people will not be happy. They will be angry. Why is he? Who is he? Because everybody wants to protect his, how do you call it? What he has. So this person wrote it in the medical, because he was a medical epidemiologist, wrote this, and people did not accept it at that point. They were not happy. Why would somebody say that we are all ignorant? Who is he? And then he said, it is surely a great criticism of our profession that we have not organized a critical summary by specialty or subspecialty, updated periodically, of all relevant randomized controlled trials. So ask yourself, it is also a great criticism of yourself, the environmental people, that even as at now, you have not started doing this kind of thing. That's why he started. So now probably by the time I finish, I'm going to create enemies for myself, but that is how the world is going. So now you don't make me an enemy. But I know most of you have started already. Let's see how best we can do, because I'm ready to all work together in doing systematic review in this ecosystem. He did not sit down when people started criticizing him or talking back, and in 1987 wrote again and referred to a systematic review of corticosteroid treatment in preterm birth. That shows that a short, inexpensive course corticosteroid treatment substantially reduce the risk of premature death to complications coming from prematurity. Sorry about that. So he did not sit down. He still came back and fought. And you know what happened? He said that evidence showed that had a systematic review been done 10 years earlier, many premature deaths could have been prevented. And this is the same thing. Let's apply this one to our environment area. If systematic review had been completed maybe 2 or 3 years or some time back, most of the policies that later on, you're going to find that the policies were not based on sound evidence, and the policies were not right because the evidence base was not right, would have been prevented. And now, because we don't know, these are the policies that people, and probably they have their bylaws and all those in binding, people who don't stick to the policies should be punished. But the whole thing is that some people would have been punished unlawfully, because later on you're going to find out that probably the evidence in support of the policy was not wrong and the policy itself was not really right. So that is what we are going to find. And Cochrane did not stop. In between 1972 and 1987, how many years? He came back. Let me show you an example. This person who was making noise over there, this is the Archie Cochrane. It is he whose name has been used for the Cochrane collaboration. If people have heard about Cochrane collaboration, because everything started from the Cochrane area. So Cochrane started as a young man, curious person, but after fighting and always on the outside, that being an outlier, he got to a point and he started smiling. Over here, you know, he's curious. He's somebody who is not smiling. It's to himself, because people who want to get things done don't always want interruptions. They always are in their own domain. They are in their own niche. But he saw a lot of things, and now look at the humor that is exuding. But at that time, he was still fighting, but laughing at people because he was seeing something that other people have not seen. And let me tell you, in this area, always it takes one person to stir up the scientific community or the policy community or ecosystem to bring about a change. And look at it. And even at the time that he was about to die, still he was fighting. So I'm telling you that those of you who are going to champion this cause, it's not that butter and bread, I can tell you. It's not easy, because this is what we have. People will tell you, this is how we do it. And that is the irony of it. As soon as you open your mouth to say something, somebody will brush you over and say, stop, this is how we do it. And this person might be an influential person, well-known person, an authority. When they do that, they kill your spirit and everything that you want to do. And that is what you have to watch out. When you want to, this is a journey that is uncharted territory, and you have to be careful. People are going to brush you off, but don't say no. Don't say, we have a team in Ghana, which is called Accra House of Always. Their logo is what? Is it their logo? What do you call it? Their slogan is never say die. Never say die. So it's a journey that you have embarked. So tell me, I also tell you this one, don't let it make one day show. And the Ghanaians have something that is a term that they normally used to say, 99 days in Agege. I don't understand it. Maybe during the time that most Ghanaians immigrated to Nigeria, something, I don't know, they say 99 days in Agege. So don't make it after expiry by 99. This is something, a course that you have chosen. Make sure that you sustain it by bringing the right people into it, as you have done today, and fight on. It's not going to be easy, I can tell you. But don't just make policies that are based on anecdotal evidence. So when he was about to die at this point, he was still fighting, and people didn't even hear him. They didn't still understand him, and they were fighting with him. So as soon as he died, he wrote the last one in 1987. But 1993, then people set up the Cochrane collaboration. The Cochrane collaboration has a branch in Nigeria, in Calabar, so you can find out over there. They are doing a lot over there in synthesizing evidence and also training. And I'm linked with them over there because I'm a partner in Cochrane and a focal person over here. We wanted to set up Cochrane, a branch over here, and it's tall. So all that I'm using as scientific, something that I'm doing, I'm giving, these are just briefs about where evidence synthesis started and where it is going. This is when the 20th anniversary of this Cochrane collaboration was just 2013, 1983 to this. All that I want to point to you is that this is where we cut the cake, and I was there. And yesterday I said it in the medical area, the systematic review I did over time, which I struggled. It wasn't that easy. That won the overall best systematic review. And then I got prize money to go to Canada to attend some conferences over there. They paid it for everything. And that was because when I was doing it, it was very difficult. But I don't want to cut corners. And that's why after I did it, the reward was obvious. I was there when they were cutting the cake. I'm using this one to tell you that evidence synthesis, all of them are evolving from this same area, medicine. But look at when it started, just 1993. I did my first systematic review in 1996. So I think if we were talking, and if not because I'm from here, I could say I was one of the pioneers in evidence synthesis. But where I am now, I'm still nobody, many people even still don't know me. I'm still struggling to make headway. But what I've said is that I won't say die, no matter what it is. As far as I still live and I'm strong, I'm going to fight on. Cochrane did not see what became of what he was fighting for. He died before people even appreciated what he did. David Sackett, I didn't mention about when I was talking about evidence-based medicine. He didn't live to see what he was struggling for. So people who want to always become or want to be recognized early, sometimes you have to know that you want to carry a lot, there will be a lot of fight for you and there will be a lot of burden for you to carry. So normally, I told Timmy, those things I don't, most of them, I don't even have website. That doesn't mean I don't have to get website. But I don't even have website advertising, just doing it so that when it's grounded, then before I shed light into them. But sometimes it also has its own negative effect. You'll talk about that later. So what we are talking about is not too long ago. This is one of the innovations that if you start, you can catch up easily. Look at other innovations like maybe how many African countries can build their own aircraft, aeroplanes, even as at now. And when was the first aeroplane maybe built? We are still struggling. We don't. Look at some of the inventions. But I'm saying this one started not long ago. It does not require a lot of capital. It's just a mental faculty. So if you begin to embrace it, you can catch up. Nobody can stop you. And this is the area that we have to look at the soft skills now to catch up. If you look at the ones that require a lot of money, Afro Nigerians, Nigeria is rich. So when it comes to money, probably I don't have to talk about that. But the rest of Africa, if you put that one in context, we have to now begin to find the soft skills. So you look at the systematic review or the story that I'm saying, people are doing from somewhere else, Europe, in most of that matter, UK, who are doing it, and some of them have been invited to join because they know that probably it is an about African issue. When we are generalizing or when we are going back to inform policies, we need Africans on board. So they'll call Africans, but not Africans leading. They know, they have been in the business for a long time. Some journals even will challenge. They say about African is problem. Why is it that you don't have Africans on board? Even when they are going for funding, so they will look for people and add people. But let me ask you, which rule have they given you? Are you only going to help them to extract papers or review papers and that is all to help? No, we have to strategically be placed. But once you are now learning, so don't go and fight for position, but be strategic and learn fast. And when you learn fast, try. It doesn't start all of a sudden. You make a lot of mistakes along the line, even when you want to produce the systematic review. Your first systematic review might not be the best that you want to produce or might not be of good quality, but you acquire the skills along the line. If you simply sit down, you don't want to do it, you'll never acquire the skills and you never understand systematic review. I'm doing a workshop this week among students and university lecturers and those clinicians or who are interested in this. And we can see the value of hands-on. So later on, this one is sensitization. When you are doing the proper systematic review, how to screen and what that to use and what to do, we will take you through that. And there's a challenge I'm throwing to you that everybody should be interested in to build yourself in evidence synthesis or the methods. So this is the Cochrane, and this is the time when during the 20th anniversary, look at this steering committee meeting. This one is in Cape Town. The only thing I could do is go in and peek through to see who are, because this is glass, it's open, you can see, but you can't, if you are not invited, you can't get there. All that I'm saying is that you don't have to fight, but you have to now begin to see why Africa is still considered a shit hole. And then why are we still not being able to do things on African soil? You can see that you don't find anybody, any African over here. But why the big decisions are made, and at the end of the story, you say, oh, from Africa. Once you see from Africa, I think that Africans have made that decision, but there's no African in it except this person who cut the cake. He was the host. He also studied in Oxford. And this is the Sir Ian Chalmers. He's knighted. He's, because of the breakthroughs he's done a lot of work in doing the Cochrane, setting up Cochrane. Cochrane is a powerful evidence-based entity in the whole world. So wherever you go, you can't go back past them. It's a powerful, and it aggregates the best minds in the world to come together to deliver. So they call trusted evidence. And then if you see the slogan over here, where did I put it over here? Trusted evidence, informed decisions, and better health. This is the motto. So they trust themselves, and I'm part of it. Yes, and because they do the quality, they do good things. So I'm using this one to challenge you as policymakers. Don't just sit down and use anything anyhow to inform policies. And I just rest my case. Otherwise, probably I would. Yes. So let's move on. From the Cochrane collaboration, now all this, if you have heard of Campbell collaboration emerged, they also use the same methods as Cochrane, and now they emerge later on, and then the EPI Center emerged. All of them, UK has done very well in this area because most of them have the origin in UK. Then after the EPI, this one they concentrate on education, things about education, so evidence about education. This one's about crime, criminal justice, poverty, disasters. They do a systematic reviews around this. And now we have the environmental, which just was set up not long ago after 2010. These are also concentrating on environmental issues, but they are all using the same approach. If I give you something to read when we are doing the evidence synthesis, you will see some of they said there was one paper that they wrote and adapted Cochrane methods, and that is what everyone is using. So the methods that you're going to use to generate the evidence is not going to be different. Today, I'm not here to tell you about how policy is made or what you need to translating the evidence into policy. No, that is what I said I was going to do in Ghana, because you have to know how the evidence is generated before you talk about policy. So I've stopped talking about policy. I have been involved in guidelines development. I have worked for guidelines development. I know how to do guidelines. And I have also even worked for WHO guideline development, have led the synthesis of evidence. But we are not going to talk about that. And I've been working with Center for Reviews and Dissemination, where we do briefs. That is, we summarize some of the policy briefs. I have some expertise in most of this, but I'm not talking about them until we find out our policymakers, our researchers are now understand the issues about evidence and they have embraced it. Then we can all move together to talk about evidence-based issues. So let's move on. These are some of the centers that are involved. This is the area that I show. One of them, when I was here, I met one economist from Oxford, and then now doing some economics over health economics over here. She started with pharmacoepidemiology, a Nigerian who was working hard at this center, the Center for Reviews and Dissemination. The center, which is called the Health Economics, it houses one of the best economists. And so if these Nigerians are to come back home to help, you won't have problems like so many other countries like Ghana and other countries. All of them have immigrated and they don't want to come back home. We have the expertise. Africa has to now begin to call its citizens and challenge them that not helping is not good enough. You have to come back and help. We have the expertise. When they come back, you will be able to help to move the Africans want. So let us move on. This is a paradigm shift. Even in the 2000s, if somebody spoke, because this started evidence-based evidence synthesis or systematic review started in the medical area. Public health is in the area of medicine. But if somebody told you that in 2000, public health area systematic review could be done, people will laugh at you. So I'm telling you that this started not long ago. So wherever you are, if you haven't heard anything about systematic review evidence synthesis, it's not that strange. Don't worry yourself. You just now begin to sensitize yourself and move with this. But the paradigm now, the situation has changed, and you can see public health area, a lot of systematic reviews are made. I just showed some centers in the UK which are involved in evidence generation and use, a lot of them. Now we can do a research in Nigeria to find out how many centers in the environmental area do evidence-based issues, or in the health, or everywhere that are involved in evidence-based. I asked one of my assistants to do is across Africa, Nigeria, we found the Cochrane, and I think one more, Cameroon, we found one center over there, not many in Africa. But even in UK, these are not all of them, a few of them. Every university you go, there's a unit over there or a center that is involved. Africa must have to wake up. It doesn't require a lot of money. It's just that we have to expose ourselves to it and force ourselves and learn, and you'll be able to catch up. Don't sit down for people to come and then use you and then dump things on us. So this is what I don't want to talk about this, because these are some systematic reviews that directly influence policy, change policies across. And my one systematic review that I did also myself, which was published in 2002, change policy. If you have heard about something about the preventive chemotherapy in the neglected tropical diseases area, the schistosomiasis, this is the one that showed that the drug they used, that there was no resistance emerging against that. I'm not going to talk about that, but when you're doing a systematic review, you will talk about systematic reviews, a lot of them that directly change policies or influence policy decisions. So let me talk about this, about the waste. I'm conscious about the time, and I have about, is it 25 minutes? So research.
You have about 20 minutes, sir.
20 minutes, okay. So all this, what is telling us is that most of the research we are doing is waste. And this one, I've been confident to say that people are rushing, and all that they're doing is that you want to publish, because that is the currency for people. As soon as people want to check your background, they want to have a sheet number and see how many publications you have made. To me, it's useless. Let us produce studies that impact policies and lives. All that people think that I'm an environmentalist. I don't deal with human beings straight away. Some people want to talk, I think, but let me finish. Okay. So, yes, people think that I'm not dealing with patients. So when you talk about health, why should I care about health? But let me tell you, all that you're doing, environment and all those, what is the ultimate? You want to improve societal good. Is that not it? So our situation, so you don't know that you are playing key role to influence health. So that's why I started health, challenging you. No, this is environment, this is not health. So even when they are talking about health, you close your ears. But all that you're doing is that indirectly, you want to influence health from what you are doing. So if you don't do the right things right and produce the good, one of them, we are wasting resources. And when you read something, I said, most in developed, this waste is a bigger problem, it's a major issue in developing countries, because over there we don't have the money, and we are wasting the small resources that we are having because the currency that just published. And if you see somebody who has published so many, in the European setting, I've seen some professors who have published a lot of studies. I don't envy, because when you sit down, you're talking about issues within methods and those, you see that, and we wonder, how could this person write 200 and over publications but still lack understanding about key issues? I'm challenging you, if you want to if you want to really change Africa, we have to change the way we do things, and we don't have to do as other people are doing. It's going to be difficult. I can tell you, the recognition will take long to come, but that is the only way that we have to do the right things and change Africa. Sometimes, so don't you feel even sometimes bad when anything about Africa is bad, and that is what you hear anytime. So I feel it, and if you feel it, you begin to sit down and think differently and find ways of changing the Africa you and I want to see. And redundant publications as at 2020 2009 led to $85 billion studies that duplicate. And this is empirical. It was published in Lancet, seeing the papers that people have published and those that are redundant. So let me move over here to go to what is happening in, show you some statistics in the medical area, because I'm seeing that evidence synthesis or systematic review started in the medical area, the Cochrane. So they are showing the statistics about the experts we have across the world in the low and middle income countries, where all the South African countries, including Nigeria, is part. Look at number of review authors from low and middle income countries in the Cochrane collaboration, because that is the only one that keeps register of people who are doing systematic review. So most of those who are in the environmental area, most of them are also Cochrane, because this one has been adapted from Cochrane, those pioneers. But later on, those who are really concentrating on environmental issues would now have to be names to be in the environmental database. Look at it. If more than 100 over here, how many? Which African country can you find? Greater than 100. I think I saw Nigeria was. Now I can't find it. But South Africa is here. Why South Africa is? South Africa houses the Cochrane collaboration register. So anybody that is trained from across Africa, anywhere, your name is put over there. So probably they did double counting. They will count everybody. If I from maybe from somebody from Ghana went to South Africa to train, probably the name will be there. And most of the people that you are seeing do not even stay in the African countries. They are the people who are staying in the developed countries, but having African origin, and therefore their names are counted as maybe coming from Africa. So from this, we don't have any country except South Africa, which is having a greater than 100 systematic reviewers. Look at the population. And now, I won't talk about that. Look at China, even China, 2,000, just over 2,000. China is about 2 billion. Just do the standardization, make a proportion of that. It is infinitesimally small. You get 0. something percent. So let's move on. Now, countries in sub-Saharan, in low and middle income countries with authors or doing systematic review, 11 to 100. You look at, and now I saw Nigeria as one of. Nigeria is here. Nigeria is doing well over here. Good, because of also what? The branch over there. So all that, those people that they train, as soon as you train, whether you are qualified or your name is kept over there, because then they have done this one for a long time at Calabar State. So you'll find Nigeria is doing well because of the Cochrane branch. And most of them are also not staying in Nigeria. That's why I'm saying that they need to call people who have domicile, those who are staying somewhere, to come back to help. We have expertise around, but they are working for other people, not helping Africa. Let's call them. Some next time when you're doing this, please search for. I know you have that power. You have that social media power. Kemi, look for those who are staying somewhere not in Nigeria, who are associated with us, and invite them to your program. It will help a lot. Discuss with them and let us build expertise. So look between the south and north, and let them, when they see that somebody is doing something interesting, they will come and probably help. We have them around. Bring them on board until that they infuse their ideas with what we can accept the ideas as are, but we can adapt the ideas, because all that they've done is in developed world, but we can adapt and then yes, use it for what we want to do. We find Nigeria, we have Kenya. So most of the African countries, we don't have expertise. Let's go over here. Even in Ghana, we have less than 10 experts with systematic review. Imagine if a country like Ghana, big country, and then you're looking for, you can't get 10 people who are systematic reviewers, documented systematic reviewers, not just even systematic reviewers, those whose name, like my friends who have been invited to join the systematic review, which is going on, they will put your name as a part of the authors. You'll be in it. But by the time you finish, probably if you are counting, you are not a systematic reviewer yourself, you have contributed, they have put your name over there. And these are the people. So the names that you are seeing here are not those who are experts, those whose name have appeared in the systematic reviews that have been published. So now look, Ghana, only how many? 8 of them. And I don't find any of them around. When I came here, I haven't found, except one person, but that person has also moved on and now not doing systematic review anymore. Nigeria too, I can count those in Nigeria, even in Ghana here. I know those systematic reviewers. I know almost all of them. They are not many. So where are they? And then if you're looking at this, if you want to build a country, Africa, and with this expertise, how can we move forward? Look at some, almost the rest of the African country, 1, 1, 1, 1, or most of them zeros. So this means if anything at all, we know a little bit about economics. We have something called demand and supply curve. When demand is high and supply is low, there are always what? Opportunity cost, isn't it? So it means that now, if you want to create a niche, or you want a career path, you want to now a future career path, there's an opportunity in this area, isn't it? A huge opportunity too, because you don't have many people who are competing. At the University of Ghana here, I can tell you, if anybody is looking for somebody who has a expertise, hey, then go to this. I don't want to be alone. I started training the PhD about 7 years ago. They haven't up till now. They are not expert now. So I say, wow. So there's a lot of demand. You don't want to be alone. Let us now sensitize, bring people on board, even policymakers. Let us move them away from what they call based on my knowledge and based on my experience. It's no longer the case. Based on my experience doesn't work anymore. We want evidence. We want the best evidence to inform our policies. That is what we want. Apart from that, there's nothing more we want. So that is that. I'm using this one to tell you that even in health, where this thing started, these are the numbers that we are having related to your environment area. We will have probably 0. And these are the environment experts that you have brought together, team isn't it, across Nigeria. And if now we don't have experts in them, what else do I have to tell you to convince you that this is an area that we need to now work on, isn't it? So on that, there are so many. Africa has a lot of experts, but where we are still lagging behind. So that's all. Listen this carefully. It's a message I've used in the healthcare area, but it's something that I borrowed it, that's why inverted commas, and I'm looking for where I find it. I can't find it. So you see, probably if the person finds that I'm using it without this, I'm in hot waters. But the question has moved beyond why is systematic review important. So now, this is what I'm telling you all. If somebody will come and say that is systematic review important, please, I won't even listen, because the question has moved from everyone knows that systematic review is important. It has moved from there to why is it not already a reality in most low and middle income countries? Yes, why is it not a reality? So don't ask the question. The question you have to ask is that why is it not happening? Why? And then the next one is, how can we all work together to make it a reality and quickly? That is all. So that is what I'm leaving you with. So now, if you find a value in this one, then next time when Temi organizes this systematic review, I will devote my time to come on board and to take you through the methods and to see how you produce a systematic review. And I'll challenge everybody to produce a systematic review, but not a systematic review for systematic review's sake. Quality systematic review, award-winning systematic review. And once we do that, we build ourselves, and nobody will come and tell us shit hole. We are not shit hole in the area of evidence generation. We know how to generate evidence, and you will do it. So thank you for your audience.
Dr. Shobamo, I want to really thank Prof for all he has delivered today in terms of systematic review. I feel his pain, I feel his concern, and I must say that he has gained a lot of apostles in us today. And we're looking forward to attending that workshop that you have mentioned, solely devoted to systematic review. I know that it has been the case with medicine in terms of application of systematic review. But one thing I want to say, sir, is this. If you consider the current COVID-19 pandemic, there are a lot of issues now that are very controversial as to which drug is effective, which drug is not effective. A lot of interests are play, political interests, economic interests. I hope that in the very short future, systematic review will actually answer all of the questions that are being raised now. So it's just a comment for me to make, sir. Thank you so much. I appreciate your delivery this afternoon.
You know that your comment is very important and it plays through dear to my heart. So it's one of them. I didn't want to, because I don't want to talk too much. Sometimes I become a bit emotional when I see what is going on around, and then we don't have the capacity to do these simple things. But you know something. So one of my, I asked one of my students, MPH students, a doctor from Chad, who I asked to now look at interventions across sub-Saharan Africa that will work for those COVID and so COVID, both those with complications and without complications. So he's doing it, and this is going to be the master thesis that he was working on. The sad thing is that I listed a very important, pertinent question, topical ones, even one which is looking at the capacity and then preparedness of African health systems, or the African health facilities for this COVID, because it started when this one this, how do you call it? This topic, I developed a topic around April, trying to, because I knew the epidemiology of this kind of epidemics, that by all means it was going to go up. When Ghana were having maybe 50s and 20s, the people say, oh, it will not. And as I knew by all means that the numbers of cases were going to increase. So I started that should the number of cases increase, our health systems, are they prepared enough to support the cases that would eventually go to the hospital? Up to now, we don't have the answers. I should have been doing it, but my places are just full. One person moving from here to there, and I don't have people who have the expertise. So that is why we are asking all of you, regardless whether in the environment area, if you know the methods, this one, next time when something happens, we can come together and work to have answers, because the same methods are used. Now we don't have answers across Africa. South Africa is doing a little bit, and there are a lot of controversies also that is going on that we need evidence. Do you know that the confidence when it came, now systematic reviews have become hotcakes and so essential, because we no longer rely on primary studies. Everybody is looking at what we call the type of studies that I didn't mention. We have the rapid studies, we have the scoping reviews, and even people from across the board, UK. I'll hear a big university professor who is advising the government called me, who I did collaboration with, who has interest in Africa, called me. This one, he needs my advice to help in systematic review too, because of evidence that they are producing, but I'm so busy now. The systematic review I'm doing now, people from US are attending now. I'm sitting in Ghana here, and people from UK are attending. The last one I did 2 weeks ago, I'm going to do another one 2 weeks ago. It's South-North collaboration, capacity building. You see, all along it has been North-South. Who has ever seen this an African something teaching? I don't want to mention names because I know where I'm coming from. It's not anytime, even when you are there, and then you teaching that person, people from the developed country, and they seeing that it's going to be a camera, going to capture something. Immediately they know how to posture themselves and then capture as if they are teaching you. Normally, see, have you ever seen Black African teaching somebody? It's no, I'm trying to play, I'm not trying, I'm playing it's serious, but I have to say it. People might not like it. Because all that we know is that Africans cannot teach these people. They also always have to teach. It doesn't have to, it has to change. So the collaboration we started this one. I'm not the lead PI, I'm not the PI. The PI understood because he saw the expertise that I would and say, okay, now most of the things our studies are are conducted in low and middle income countries, Asia and Africa. But we have the collaborators, the principal investigators are from developed countries. So let us do South-North capacity building. Now, it's from here, I'm teaching those from UK. It's not everybody in the UK who knows systematic review. Canada and all those, and those who are involved in the project. I've started a series and I'm teaching them systematic review. And the first one was really well accepted. So I'm saying that, please, let us use our innovation very well. African people have known that our innovation is in the area of theft and criminal and other things, and that's what they have labeled us for. Please let us begin to change and use this, our intelligence, to now begin to challenge this one, the soft skills that we have. There are a lot of things that we can do to move Africa forward. Africa, we went when we made during the African Academy of Sciences, Tim, you remember the kind of presentation that people were producing and looking at the demographics, showing that a time will come that Africa is going to be the leader in the world. We have to start and think that way. We have to think in the long term. And if you do that, you begin to prepare against time, and that's the only way we can make that impact. Everything that you do, look at whether it is impacting people's lives. And once that is true, yes, if I write only one publication and I die and go, it impacted people's life, I'm happy. If what I'm doing would impact people's life, I'm happy. That is what we have to begin to think instead of self now. So, my friend, I'm very happy about the question you raised. People are looking for evidence to help African policymakers, rapid one, to make decisions. African policymakers are looking for evidence. They are not getting. So what? And we have intellectuals around. So this is an area. This is the gold standard methods that we have to now begin to ground ourselves in. And once you are there, you yourself will see the competence and the confidence that can, because everywhere they throw, you are there, you understand things, especially when you have the critical appraisal skills too. Then people see you, and then anytime I go to some of these Cochrane conferences, nowadays I'm not going. They see somebody as African who is a threat. Can African be a threat? And they see you as a competitor. No, this is where we want to go. I'm speaking with confidence and boldness because I know where I've been. I've worked in Europe for more than 20 years. And I know what I'm talking about. And I still live there. I'm still part of it. And I'm still part of the system. So I am both there and here. So I'm just.
Thank you, sir.
So maybe I've always encouraged Dr. Temi Tokwe-Sowami that this is a topic that is unique for Africa, and it's also not very common.
Yeah.
And such that for us to get it done in Africa, we need a critical number.
Yeah.
Something like movement that you mentioned in your lecture. So I want to use this opportunity to say that after this, we're going to build up a network. It's going to be our chairman, because you're more than an ambassador. Why is it, though it sounds new, but it's not new.
Yeah.
If you watch policies across Africa, especially policies we have in Nigeria, so many, 3/4 of policies are just sitting there in the lockers. You know, they're just sitting there in the shelf. They are not implemented, and when you try to implement them, you also meet difficulties.
Challenges.
So the question now is, why is this beautiful policy meeting challenges on implementation? And that goes to say, was there any evidence when that policy was coming into effect?
Yeah.
That policy coming in to solve some problems, or are problems going to pursue the policy?
Yeah.
So I think, putting in perspective, we need in Africa to start dealing with numbers.
Yeah.
We cannot all the time be speaking in abstract as if you can make it in the next century by taking that pathway. So I think there is need for change. That change is now.
Yeah.
Better time than now to change the narratives. And I must congratulate Dr. Shubaman. I must also congratulate her for leading a movement in Nigeria.
Yeah.
And already the university, UNILAG, and Federal Minister of Science and Technology are coming into collaboration. Okay. And if not for this COVID, we have organized what is called the Sustainability Science Dialogue, Global Sustainability Science Dialogue, where we will bring in lawmakers, policymakers, politicians, businessmen, heads of state and government to talk about using science and technology-based data to make informed decisions, including across sectors, agriculture in particular. If you notice, agriculture in Africa, it has more of theoretical. People always refer to old methods of farming and all of that. But this is time that we should be talking about agriculture that is productive, not agriculture that carries numbers and are not productive. Not agriculture that 1 million people will be engaged and few are being fed. So we should be talking about agriculture where few are engaged and the whole continent is being fed, meaning that you are optimizing resources, inputs that go into agriculture, including human and material resources that go into agriculture. Why? Because in the next 5 to 10 years, Africa's population will likely double. Yeah. If it doubles, the space is not increasing. The arable land is not increasing, it's fixed. Yeah. Therefore, strategic planning, doing a scenario planning in the area of agriculture, for instance, requires that we begin to intensively mechanize agriculture, reduce the number of people that go in there, so as to increase yield per hectare of arable land, so that you live in this population, talk about sustainability, you live with the future generations so that they should have a space to urbanize, they should have a space to live, they should have a space to also plant. So these are things that should be going into policy making and policy decisions. If you leave agriculture, you talked about health. That one is not even driven by any form of data. Health planning in Africa is not at all. We're not talking about numbers. Now, COVID is with us. Where are the health facilities? Nobody is talking about that. If COVID comes in large numbers, where is infrastructure to handle all that? So this is what systematic reviews requires. You need to do that, not only in health, in all the sectors, environment, agriculture, industry, even tourism we are talking about. We say tourism is so rich, it brings so much money. Who can give us in terms of numbers that tourism, this is what it has done to Africa? We oftentimes say Africa is richly blessed, so much raw material. Can anybody give us in numbers, gold, diamond being carted out of Africa? How has it enriched Africa? So I think this is the time. Your lecture is coming at a very good time. And with you, we need to form that mass movement, no matter how small that number is. But we must begin to do that right now. And this is the right time to do it. So I want to thank you so much for well-delivered lecture. And I will thank Dr. Temitope Sobon, who has been very, very hardworking. I worked with her when she did the Science Policy Fellow for 1 month. And I said to myself, if every academician can be as that productive, because the issue is not publishing paper, 1,000 paper, and you are answering professor without a product. Yeah. But they actually is to come up with product, come up with patents, no matter the area where you are. Even if you are in literature, you must come out with patents. Where has your knowledge improved society? So this should be the trend going forward. I must thank you so much. And going forward, I will share my contacts with you and all of that, and we see how we can form movement now. Thank you so much.
Thank you.
Sir.